Clinical psychology is an integration of science, theory, and clinical knowledge. How can addiction facilities benefit from having a clinical psychologist as part of their senior management leadership team? I'm your host, Suzanne, and this is Recovery Matters. Dr. Tina Goodin is a board-certified psychologist and the Chief Clinical Officer at Artisan Wellness and Recovery Centers. She is a leading executive administrator for addiction treatment centers and for behavioral health facilities. She has been in private practice for 27 years and works with children, adults, and the elderly. She is a well-known speaker, author, radio talk show host. Welcome, Dr. Goodin.
Hi,
so
Suzanne.
Nice to see you.
Thank you for having me.
So I want to start a little bit. Tell me about what made you interested in the field of clinical psychology.
Well, now, about 27 years ago, I realized that there were a whole lot of people out there who were in need of services that weren't being offered. And I thought, you know, in my role in the family, I was the helper, as the typical therapist is.
Right.
And so I thought it might be a great idea to be able to bring that out there and see what I can do to add to the mental health of people in need. And so I decided to pursue the academic part of it. So I did my master's degree and then I did a PhD. And I became interested in the unconscious. And I decided that I would become a psychoanalyst as well.
Oh my goodness. Isn't that Freudian?
It is totally Freudian, and I tell you, I use it every single day, but nobody knows that I'm using it.
Right.
Because I sort of transform it into action, and what are we going to do, and I use it in all my leadership skills as well.
Has psychology or the role of a psychologist changed over the years?
Yes, it has to some extent. You know, years ago it was a very young field. It's still pretty young. At the same time, years ago we didn't have instruments, testing instruments that we have today. Years ago we didn't have brain mapping that we have today. And years ago we didn't really understand the neurophysiology of some of these entities that we are calling mental health disorders. Mm-hmm. And so now we're better equipped to understand that we were not just working willy-nilly with ideas that come to our mind, and research has helped us with that.
So you've been in private practice, you've been in the field for the last 27 years. What has made you want to go into now heading up an administrative leadership team? What has made you want to now go and impact facilities with regard to addiction?
So what has happened is that years ago, I was an administrative leader without even realizing that I was doing that, believe it or not, because it happened in a very natural way. I saw this void in a hospital where they weren't offering any psychotherapy services. So I went to the board and I said, well, you know, guys, you need to have some psychotherapy services here. And I created a business plan, and I created financial plans, and I created programming and clinical services and resources. And I brought it to the board, and the board decided this was a fantastic idea, and they wanted it.
Right.
So I was planted right in the family medicine unit inside a hospital, a huge hospital that is part of a McGill University teaching hospital. And McGill University, for those who don't know
Isn't that in Ottawa?
It's in Canada.
I'm Canadian.
Oh, you are?
Yes.
Well, so am I. And so McGill University, as you know, is the Harvard of Canada. And so this hospital, the Queen Elizabeth, was a residential hospital. And so we began in family medicine. And so it started off with me, one person, one idea, and a few dollars.
Wow. How frequent is it that facilities don't have a psychological component that treat people? I mean, was that instance sort of like an unusual case, or does this happen quite often where there is no administrative leader that can have the clinical psychology component?
It still happens to this day. You'll go into hospitals where they have psychiatry, mm-hmm. which is basically medicine, and nursing, which pays lip service to psychotherapy because they're actually not necessarily trained to offer those psychological services. And then we'll have social work, which is more like out in the field, mm-hmm. connecting the patient to the family to the community, mm-hmm. and services that they can get while out there. So this was very innovative at the time, and it became a huge success so that we were serving 10,000 patients a year, And our bottom line was soaring, so that, you know, if every patient cost $1,000, we were bringing in a lot of money to that endeavor. And it was called the counseling service. And what I did was I built an internship site there with the universities. And so we took in interns who we paid a stipend to,
right,
and trained them. And so we were able to extend our services outside.
So now you're
of
an
family
educational facility.
Exactly. And moved into the Department of Psychiatry, inpatient, outpatient, people with chemical dependence, eating disorders, or dual diagnosis for sure. And so now this became a huge endeavor. Bottom line was extremely successful. And I single-handedly built this, you know, with my psychology hat and my clinical administrative leadership hat.
So now, how did you turn your interest specifically into addiction? What led you to that field?
Good question. So I moved to South Florida. I had been doing chemical addictions and addictions while in Montreal. However, it wasn't an addiction facility. It was a psychiatric department. You know, we were housed, we went from family medicine into psychiatry. So it was personality disorders and all kinds of relationship, the typical, and a whole lot of addictions. So when I moved to Florida, it was an interest of mine because I saw that A, there was a need, and B, there were many facilities. So it occurred to me that it made sense for me now to focus on that part of my expertise.
So when you look at the difference between healthcare in the American system, and now that I know that you're Canadian, and healthcare in the Canadian system, I remember back in the day about, I guess it would have been about 20 years ago in Canada, psychiatrists at the time did psychotherapy. Now what I understand of the American system here, psychiatrists do medicine, and clinical do clinical.
Yes.
When we come back, let's talk a bit more about how that impacts a treatment team, and why we need that extra position of a clinical psychologist and how they can impact the complete leadership team.
That would be wonderful.
Thank you.
Thank you.